Let's talk a little bit more about just what the consumer is experiencing in healthcare delivery, which is the shift from inpatient to outpatient, and how Providence has been kind of championing their efforts in that shift to outpatient care as well.
Yeah, so about 3 or 4 years ago, we came up with this idea, now we built and constructed this big, huge health system. Why don't we deconstruct it? And it was purely through the lens of the consumer, combined with all of these outsiders coming into our space, the drug companies, Walgreens, et cetera, et cetera. And so what we did is we deconstructed the entire ambulatory care network, the entire physician enterprise, and the entire what we call home and community services. So this is everything from our long-term care facilities to hospice care and home infusion, those kind of things. Sure. And we deconstructed it, and there was no sacred cows, meaning you could come forward with whatever you wanted to do with your business and we would assess it. And so just to give you an example, on the ambulatory care network, I think we have over 400 sites now between express care, urgent care, ASCs, et cetera. And we actually had accumulated an incredible set of ambulatory assets. We just were not using them as it related to what they needed to be used for. They were a distribution channel to a hospital system. Sure. And so when we peeled them apart and looked at our cost structures, look at our contracts, look at our governance models, look at our joint ventures, we said, time out. We need to redesign it where not only is it a distribution channel to the hospitals when appropriate, but also it needs to be able to compete affordably with all of its for-profit competitors. And so that's what we've done. So we've done it. We've redesigned comp models that are more competitive, that are actually more affordable, because they're not laid into a historical hospital comp model. They're not laid into the tenure of those contracts. And people who really like to work at an ASC don't like working in a hospital OR. Sure. And so it really was just deconstructing it all the way. To get back to your point around the patient-friendly financial services, we made a decision on the physician enterprise to no longer have the hospital side of the house do revenue cycle. So we bought a company out of Iowa called MediRev. We own 51% of it, and they are dedicated to that. And they've had better results for the consumer by doing that as a physician group focus. And so that's what we've been doing. We've done it, like I said, for the physician enterprise. I told you a little bit about the physician, sure. the governance model. We've done it for the ambulatory care network, and we've done it for our home and community services, which is really interesting. It's probably the fastest growing part of the organization because of the growth, the aging, and the willingness for people to have services at home. And it's actually maybe the first one of our businesses where we've ever gone into communities where we don't have hospitals or clinics, because we think there's some real great opportunity in that particular space. Sure. Because there's a lot of kind of weak providers in that, and we have great net promoter scores and great satisfaction there. So that's our kind of deconstruction. It's really deconstructing through the lens of the consumer.
Sure. But effective in the long term, which is really the overall goal.